is with Dr. Anjy. As you know, what we do here is we pick issues that are of importance in the society and we consider it from both sides of the narratives. Today, we're looking at an issue of very, very great importance because we see it all around us. The million-dollar question we ask when we see people who behave in a certain way, they look male, but then we realize that they behave like females. So we want to ask this million-dollar question. Which borders are youth? Why do I feel strange in my own body? And to do justice to this with me today is a very important person. I'm not going to let the cat out of the bag yet. We'll be right back. Welcome back. Now I have with me today Dr. Rita, a distinguished personnel, I must say. Dr. Rita is the immediate past head of department of the Department of Sociology and Psychology, Leeds City University, where she teaches. More so and very pertinent to discuss today, she has a certificate in gender studies from St. Mary's University, Nova Scotia, Canada. Dr. I'm delighted to have you here to talk about this issue. So let me ask you, we see it all over social media where we find males dressing like females, or we find people talking about it generally, about a disconnect between what they look like in terms of gender and what they feel like inside them. So as a psychologist, what's your take on this?
Well, thank you. First, let me thank you for having me on the program. The issue of the disconnect between the assigned sex at birth and the social construction of gender is it's been going on for a long time, and even in Nigeria, as it's not strange. The first case of gender dysphoria, as we refer to it, was, I think I heard about it about 20 years ago. This law student yes, who, Dapo, I think his name was, when he did his gender reassignment surgery, he became Dupe, and he actually was a prettier Dupe than he was a Dapo, So, yes, unfortunately, in the year 2019, I think, they said over 2,000 cases, 2,600 cases of gender dysphoria was diagnosed amongst children. That led to psychologists resigning. There's been a lot of argument. WHO actually says we should not term the issue mental health disorder, but that we should just say, in fact, the term they want us to use now is gender incongruence. That is that dissatisfaction. Yes, that's dissatisfaction between the chosen gender, the birth gender, and what they're feeling. Okay, and so it causes a lot of emotional and psychological distress, and has led to self-harm. People hacking off their breasts or hacking off their genitals because they want to fit into a particular. So it's like saying God made a mistake. He put me in another person's body.
Let's imagine the Nigerian scenario, the African scenario to this phenomenon. How do parents react? How do people react?
Well, unfortunately, one of the things that the students that I mentor tell me is that their parents don't talk to them. Okay, and that's a serious issue because it means that either parents are in denial or the parenting style is ineffective. Psychologists have determined 4 parenting styles: the authoritative parenting style, the authoritarian parenting style, the permissive parenting style, and the non-involved. I don't actually even usually refer to that because if you're not involved in parenting, then that's no parenting. Yes. However, because in Nigeria there's a culture of silence. There's they feel that children should be seen but not heard, and unfortunately it still goes on up until now. And a lot of why issues such as gender dysphoria lead to suicide or depression is because nobody's paying attention. So usually when students come to me, I tell them, look, it doesn't have to be your parents that you talk to. You can talk to maybe an elder, or an older friend, You can look for somebody to mentor you. You can talk to. So usually my classes turn into counseling classes because they are given that opportunity to vent.
Dr. Akimbade, imagine I'm one of your students and I sit right across your table and I tell you, I want to be male. I don't like my gender. What advice would you give me?
Yes, I will tell you that you should go for counseling. Because why did over 35 psychologists resign in the UK? Like I said, because the cases of the diagnosis of gender dysphoria amongst children, we're not even talking of adults now, amongst children as young as 6 years old was rising. And in 1 year alone, they had over 2,600. So they felt that first they were being misdiagnosed. And rather than the UK, in the UK, they pay for gender reassignment surgery. That's the irony of it. So they're saying that, you are over-medicating these children and you're over-diagnosing these children. Before you can even determine whether somebody is gender dysphoric, it has to have persisted for a period of at least 6 months.
You're talking about it. You mentioned something about parenting styles. But what happens even when the parenting style is very effective and the child just refuses to talk?
If the parenting style is effective, and of course the effective parenting style is the authoritarian parenting style, authoritative parenting style, not the authoritarian, in which boundaries are established and you explain to a child. A good parent notices signs. If you're a good parent, sensitive to your children, we talk about individual differences. People are different. They react differently, they express themselves differently. But a good parent will notice when there's a change in the child. And that is when you begin to try to get the child to talk to you. No matter what, no matter how reserved children are, once they know that there's that non-judgmental atmosphere at home, they're going to open up. It's because people are scared of being judged. And Nigerians are very judgmental. They're very sanctimonious.
I think that's a fantastic thing. I also believe the take home here with what you've just said, that we need to be looking out as parents and we need to reach out and they should be talking to us. And that is very fundamental. Dr. Rita, is there a difference between gender dysphoria and gender identity?
Well, gender dysphoria is all about gender identity. There are different gender, we have now the transgender, it's been there for quite a while. So when you talk about gender dysphoria, you're simply saying that my biological sex, because sex is biological characteristics, gender is socially constructed. That is what society expects. This is how a man or a woman should behave in society. So the gender dysphoria is that even though my biological sex, my biological gender is male, I feel that I'm actually supposed to be a woman. So that is what the gender dysphoria is. That's mismatch, between the assigned, the gender and what they feel is their gender identity. Like I talked about, you have Bobrisky, you have James Brown. We have Derrida, we have so many.
And if I may have, we have so many others who are somewhere tucked in, behind closed doors, who also feel that way.
Yes, of course, because they know that they're going to be judged. So it's very difficult to come out of the closet.
So, if I want to come out of the closet, as the Nigerian government, is there any organization that has made room for me to seek help?
Well, I know that there are NGOs that try to handle, for instance, those ones that work with commercial sex workers, who are, trying to get people not to label people. But I don't know of any organized body yet, because it's still an emerging issue in Nigeria. It's there. It's just.
It is there. The reality is that it's there.
Yes, it's there. But a lot of people are in denial. But it's increasing, because if for a mega Pentecostal church to send out notice to all their parishes that people should now start going for premarital medical examination to ascertain gender at birth.
Before marriage.
Before marriage, because of the crisis that is ongoing in marriages right now, tells you that people know what is going on. So there are many, even in Nigeria, that have done gender reassignments surgeries and have now, they've taken hormone, what do we call it, puberty blockers and hormonal treatments to grow breasts or to grow penis, So those are, those ones you need to do the surgery.
I think this is just a call out to every adult out there, every person, every shoulder that can be leaned on for young people, not just young people, I guess. I think it runs across all the ages.
What is his name? Kim Kardashian's dad, Bruce Jenner. Wasn't it at 44? Former Olympic medalist, a man, says at 44 he's no longer a man, he's a woman.
So this is a call out. I think we should make it a reality in our society. Even religious bodies are, recognize this reality, and I think it is very important that we should be talking. Now, at Talk Narratives, we always consider both sides of the narrative. So very soon, we're going to bring you someone who is going to give you a first-hand perspective of what they went through. Dr. Rita, I cannot thank you enough for being here with us. And I want to call on you again. You will not hesitate to oblige us.
Thank you for having me. It's been a pleasure.
Thank you so much. All right, so thank you for joining me on this edition. Don't forget to click on the notification icon and, of course, subscribe to my channel. See you soon. Bye.